So continuing with the sentinel events, let's talk about the third point, that is the criminal events. So criminal events are many, like for example, letting of poisonous gases, or maybe some kind of murder or something like that that might happen in a hospital setting, and maybe you do not have that much of enough of CCTV cameras to identify who did it, or maybe there are certain secluded places in the hospital where such kind of event can happen. In hospitals, we have seen examples in the history that how a female health staff has been raped by by many people, by the male staff of the hospital, and under jurisdiction, under the law and all, it could not be identified. However, it has the hospital planners must also take into consideration that there is a secluded place for the female patients and the female attendants, and the male patients and the male attendants, and also the corridors are big enough, there is enough light and ventilation, as well as there is enough of surveillance in that place. The next point is fall with harm. So that's what I explained to you in the previous video also. Like for example, if the patient is taking treatment in the hospital and the patient fall down from his bed, or maybe the stairs are very steep that the patient is not able to walk and he trips. So in that case also, that also must be taken care of. When we are planning the hospital bed must be designed in such a way, or the hospital bed should be that there is a protection for the patient, that either he or she doesn't fall, because patients are in a state where they are sick, and the orientation is very much diminished, so there is a very high chance that they might fall from their bed, or they might fall from the stairs. If there is no ramp, then it creates a little bit problems for the patient's transportation. Infections, yes, infection is one of the most important thing, right? As we have discussed earlier as well, hospital-acquired infections, or nosocomial infection that we say, if the ventilation system or the air circulating systems are not well placed in the hospital, then of course the infection rate might go up. And if the isolation places are not well equipped, or the infrastructure are not well built, then it might lead to the exchange of infection from one part or to the another part. So positive pressure of the air, negative pressure of the air. So these are the things that we must be taken into consideration. So delays in treatment, yes. Because of infrastructural problem also, of course, the treatment delay might also happen, because the area in which the patient has to be contained might be less, or maybe we do not have that much of infrastructure to support the heavy load of patients. Elopements, yes, elopement is one of the most common kind of scenario which we see in private hospitals, or maybe also in government hospital, where the patient party is not able to pay the money to the organization, and the patient is admitted, and since because of inability of payment, the patient might elope. And sometime in case of the patient is so much scared of the treatment procedure that he elopes the previous day or the previous night of the procedure. So that must also be taken care of. So security and the infrastructure should be in such a way that the access, the entry and the exit to the hospital building has to be always under surveillance. Fire, yes, fire is one of the most important thing. There has to be enough room for all the fire safety measures and equipments in the hospital setting, and you must make sure that if in case of there is a fire, then what is the protocol of exiting the patients or transporting the patient outside of the hospital building. Enough signages must also be placed inside the hospital as to which is the exit that is being used in case of fire or any other disaster situations. Medical equipment related injuries. So with this we will be mainly seen in case of radiology and imaging services, where medical legal equipment related injuries might occur, or maybe people are not well equipped about what are the directions that has to be taken care of before entering a place where an equipment has been placed. So this mainly occurs in case of rooms like MRI, where there is a high magnetic waves, and we have seen there are a lot of videos regarding that also in YouTube, so you can go and check out those. Medication error, yes. Medication of error also happens if there is a less of light in the room, or maybe the transportation of the medication from the pharmacy to the place is also not enough. Then medication occurs. Operative and post-operative complication, yes, these might also happen because of inability, because of insufficient infrastructural places, restraint related injuries, and other events such as drowning or found unresponsive. So these are the things which might be prevented if we have a good hospital planning design. So I think we are done with this lecture, and we'll move into the another topic. Thank you so much.